This is Pack 365. Myself Srija. So today in this session, you are going to learn about ICD and CM coding classification for diseases of genitourinary system. So what does chapter 14 tell you? So this chapter in ICD and CM, it includes all the codes which is used to classify diseases and disorders of the urinary system, male reproductive system, female reproductive system, and also breast related disorders, mainly female. So these codes, they are important for medical billing, insurance claims, diagnosis documentation, and treatment planning. So body systems which are covered in chapter 14, that is urinary system. So this includes organs that make urine and remove waste from the body. Kidneys, what they do, they filter and produce urine, right? So ureters, the tubes that carry urine from kidneys to bladder. And bladder, it stores urine. And urethra, it carries urine outside the body. So what are the examples of common conditions coded in this category? So kidney infection, pyelonephritis. So kidney stones, chronic kidney disease, urinary tract infection, and incontinence. So next system is male genital system. So structures involved in reproduction in males are prostate, testes, penis, and scrotum. So what are the examples of common conditions? BPH, prostatitis, testicular cancer, erectile dysfunction, and hydrocele. So next system involved in chapter 14 is female genital system. So reproductive organs in females are uterus, ovaries, fallopian tubes, vagina, and vulva. So what are the examples of common conditions? Ovarian cysts, uterine fibroids, endometriosis, pelvic inflammatory disease, and menstrual disorders. So what are the breast disorders? This includes female breast diseases such as mastitis, fibrocystic breast disease, breast lumps, and breast cancer. So what is the ICD-10 code range in this chapter? So codes N00 to N99. They are organized into blocks based upon location and condition type. So what is the purpose and importance of chapter 14 in medical coding? So why it matters? Because it helps in accurate claim processing. Like it helps in the insurance to understand the diagnosis and to approve the payment properly. It also helps in the documentation support, like it reflects the correct clinical condition in patient records. It helps in HCC risk adjustment, and also it helps in standardized classification. So what is a simple example? So if a patient has chronic kidney disease stage 3 coder, so coder will use ICD-10 code N18.3. So if a patient has UTI, so coder will use ICD-10 code N39.0. So this chapter 14, they helps the healthcare professionals to identify the urinary and reproductive diseases, to select correct ICD-10 CM codes, to improve documentation, and also to ensure accurate billing and reimbursement. So this chapter 14, so the diseases, these are classified into different related to the kidneys, urinary system, male reproductive system, female reproductive system, and breast. So what are the code ranges over here? N00 to N08. So this category, they involve glomerular diseases, like diseases which are affecting kidney filtering units. So N10 to N16 is renal tubulointerstitial disorders, like problems in kidney tubules and surrounding tissue, for example like pyelonephritis. And N17 to N19 category codes, they involve acute kidney failure and chronic kidney disease. So N20 to N23, they involve calculi of urinary tract. So N25 to N29, they involve other disorders of kidney and ureter. So N30 to N39 category codes, they describe about urinary system disorders. And N40 to N59 about male genital disorders. N60 to N64, they describe about the breast disorders. And N70 to N77, these category codes, they involve about the inflammatory diseases of female pelvic organs. And N80 to N98, non-inflammatory disorders of female genital tract. So N99, they describe about intraoperative and post-procedural complications. So why understanding these codes ranges is important? Because it helps coders to quickly locate the category of the diseases. Like it improves the accurate code selection, leading to the correct insurance claims. It also helps the physicians to document precisely, and it ensures the proper patient treatment classification. So now coming to the first category, N00 to N08, which describes about glomerular diseases. So this ICD-10 codes, they describe diseases that affect the glomeruli, which are the tiny filtering units present inside the kidneys. So what is the job of the glomeruli? Their job is to filter waste and excess fluid from the blood to form the urine. So when the glomeruli become inflamed or damaged, the kidneys cannot filter properly. So what is the first category? N00, acute nephrotic syndrome. So what does acute nephrotic syndrome describe? This condition, it involves the sudden inflammation of the glomeruli. So what are the common causes of the acute nephrotic syndrome? What are the symptoms? Here you can see in this picture. Blood in the urea or blood in the urine, which is called as hematuria. You can see protein in the urine, which is called as proteinuria, and blurred vision, high blood pressure, nothing but hypertension, low output of urine, and abnormally high levels of nitrogen containing substances. So these are all the symptoms of acute nephritic syndrome. So what are the subcodes of N00? So N00.0 for acute nephritic syndrome with minor glomerular abnormality, and N00.1 for acute nephritic syndrome with focal and segmental glomerular lesions. So for example, a patient develops swelling and blood in the urine 2 weeks after throat infection. So which code you will assign? N00.9. So next is N01, rapidly progressive nephritic syndrome. So this is a very severe and fast progressing form of glomerular inflammation. So what are the characteristics of this syndrome? Rapid kidney failure within days to weeks, crescent formation seen in the kidney biopsy, which can lead to dialysis or kidney transplant if not treated quickly. This is often due to autoimmune diseases like Goodpasture syndrome and vasculitis. So what is the example? Biopsy showing crescentic glomerulonephritis. So which code you have to assign? N01.9. So what is the difference between N00 and N01? So future onset, the future is onset. This is an N00, it's an acute inflammation, whereas N01, it is rapid plus severe inflammation. So coming to outcome, future N00, it recovers with treatment. N01, it is high risk of kidney failure. So when biopsy N00, it appears mild to moderate change, whereas crescent formation takes place in N01. So this is a diagram of a kidney biopsy, which is a microscopic view, which is pink in color, right? So crescent formation. So this is an abnormal accumulation of inflammatory cells surrounding the glomerulus. This is the glomerulus. So this is the abnormal accumulation of the inflammatory cells. So next, what is the compressed capillary lobes? These are the filtering units which are squeezed. So kidney can't filter blood. And next is a fibrin deposition. It indicates very severe inflammation. And normal tubules. So these are the tubules which appear unaffected initially, showing damage primarily in the glomeruli. So understanding the crescent formation. So how does a crescent forms? A crescent forms when a glomerular basement membrane is damaged. So next, the blood and inflammatory cells, they leak into the Bowman space and cells proliferate, forming a crescent shape. So why it's important? Because crescents are severe and rapidly progressive kidney disease. Without urgent treatment, it rises into the kidney failure. So next code is N02. So it describes about recurrent and persistent hematuria. So what does it mean? It means blood in the urine that keeps returning. Like it indicates repeated damage to the glomeruli. It is often seen in IgA nephropathy. So what is the example? A patient with recurrent episodes of blood in the urine after respiratory infection. So which code? You have to assign code N02. And next is N03, chronic nephritic syndrome. So chronic, the word chronic means a long term, right? So long term persistent nephritic symptoms. So it results in the gradual kidney damage, and symptoms may include hematuria, mild proteinuria, hypertension, and also gradual loss of kidney function. So what are the common causes of this chronic nephritic syndrome? Lupus nephritis and post-infectious glomerulus that becomes the chronic. So next is N04 code, which describes about nephrotic syndrome. So nephrotic syndrome, it is characterized by very heavy protein loss in the urine, So proteinuria more than 3.5 grams per day, and you can see the edema, that is swelling, which is around the eyes, legs and abdomen. And also hypoalbuminemia, which is a low albumin. So hyperlipidemia, high cholesterol or foamy urine within due to protein. So also risk of blood clots and infections. Now what is pathophysiology of this nephrotic syndrome? Damage to the podocytes, which are the cells that filter proteins, food processes detach, and also proteins leak into the urine. So what is the example of this nephrotic syndrome? Nephrotic syndrome due to minimal change disease. So which code you have to assign? N04.0. And you can see pathophysiology of nephrotic syndrome on the right side. There is a picture. This is a foamy, right? Foamy urine, sign of proteinuria. And these are the podocytes. So these are the signs and symptoms of the nephrotic syndrome. So next is N05, unspecified nephritic syndrome. So this is used when doctor confirms nephritic syndrome but cause or type is not specified. For example, like early stage evaluation without biopsy results. So next is N06, isolated proteinuria. So only protein in urine is present. No hematuria, no edema and no kidney failure. So this is often found in athlete proteinuria, orthostatic proteinuria, which is a posture related. So next is N07, the hereditary nephropathy. So what is hereditary nephropathy? A kidney disease due to genetic causes. So this also includes the Alport syndrome, which results in the progressive hearing loss and also about the kidney failure. Now, what is the major difference between nephritic syndrome and nephrotic syndrome? So the main issue is inflammation in the nephritic syndrome and damage causing the protein leakage within the nephrotic syndrome. So the urine is present within the blood in nephritic syndrome, whereas in nephrotic syndrome, the urine is rich in high protein. So the BP levels are very high in nephritic syndrome, whereas in nephrotic syndrome, normal or very high. So next is N08 code, which we use for glomerular disorders in diseases classified elsewhere. So this code it is used when kidney glomerulus damage is secondary to the another disease. For example, like lupus nephritis, which we code N08.5. So lupus, it affects many organs, including the kidneys, causing inflammation of the glomeruli. So next category codes ranges from N10 to N16. So these diseases, they affect the renal tubules and interstitial tissue, the spaces around the tubules, but not the glomeruli. Hence, these are called as tubulo-interstitial diseases. So what is the first code? N10, acute pyelonephritis. So what do you mean by acute pyelonephritis? It's a sudden bacterial infection of the kidney and renal pelvis. So it is commonly caused by E. coli ascending from urinary tract. So what are the symptoms of the acute pyelonephritis? Fever, flank pain, nothing but side or back pain, burning urination, and also increased frequency. So positive urine culture for bacteria. So what happens in the kidney? White blood cells infiltrate the kidney. Formation of a microabscesses takes place and medullary areas, they become hyperemic, red and swollen, which is shown in the image like pus-filled areas. You can see right here the pus-filled areas and inflammation. So the next is N11, chronic tubulo-interstitial nephritis. Nothing but it's a long-term or repeated kidney infection or inflammation. So this causes the progressive damage which results in scarring, which results in kidney shrinkage, and then there will be a loss of function. So what are the subcodes? N11.0 for non-obstructive chronic pyelonephritis and N11.1 for chronic obstructive pyelonephritis. This is due to obstruction, for example, like kidney stones, enlarged prostate and reflux. So there are pictures shown here. So the first picture, it shows you the diffuse irregular scarring, a thin cortex and the dilated calces and renal pelvis. So this obstruction, it leads to hydronephrosis. So what is hydronephrosis? The N12, tubulointerstitial nephritis unspecified. So this is used whenever it is not clear if it is acute or chronic. So general inflammation without specific type is identified. So the first image is, it shows a cut surface of a kidney affected by acute pyelonephritis. So what happens? Why this one is happened? Because bacteria travel upward from the bladder to ureter and then to kidney through ascending infection. So the body sends immune cells to fight, which leads to pus formation, which causes pain, fever, chills and burning urination. So what are the symptoms of this acute pyelonephritis? Sudden onset, high fever, flank or side pain, nausea or vomiting, and also urine positive for bacteria and WBC cast. And the bottom image is, it describes about the chronic pyelonephritis. So what does this diagram show? The long-term or repeated kidney function infection which leads to progressive damage and scarring. So you can see the recurrent acute infections or obstruction preventing the normal urine flow. So this can eventually lead to the chronic kidney disease. So you can see a diffuse irregular scarring, nothing but repeated inflammation which destroys the kidney tissue. And you can see the thin cortex, which is a surface layer of the kidney, which becomes thin due to tissue loss, and shrunken kidney because a smaller over time, and thickened capsule, which is the outer covering, which becomes fibrotic and tough, whereas dilated pelvis and calyces, this is because of back pressure from obstruction or reflex. So why is obstruction? Due to kidney stones, enlarged prostate or vesicoureteral reflex. So whenever acute pyelonephritis is diagnosed within the patient record, you have to assign code N10. And chronic tubulointerstitial nephritis, you have to assign code N11. So next is N13, obstructive and reflex uropathy. So what do you mean by obstructive and reflex uropathy? The conditions in which the urine flow is blocked or flows backward from the bladder to kidneys. So this causes the pressure, dilation and also the kidney damage. So what are the examples? N13.2 for hydronephrosis due to stone. So this means a kidney swelling because urine cannot drain. And next N13.7, which is for vesicoureteral reflex. So in this, the urine flows backward towards bladder, ureter and kidney. Here is a diagram. So the image shows normal side, urine flows from the kidney to bladder out through the urethra. So the reflex side is valve at the ureter bladder junction, which is weak and urine goes back up. So this backflow, it causes recurrent infections and kidney scarring. So what are the symptoms of this obstructive and reflex uropathy? Flank pain, repeated urinary tract infections, dysuria, fever, and in children, bedwetting and poor growth. So N14 category code is for nephropathy induced by drugs or toxins. So kidney injury is caused by medications or toxic chemicals. So example in the slide is given NSAID nephropathy. Which code you have to assign? N14.1. So here is a diagram which is showing NSAID effect on GFR, that is glomerular filtration rate. So this picture compares the normal kidney blood flow and the reduced blood flow with NSAIDs. So the normal kidney, so prostaglandins, they dilate the efferent arteriole, which results in good blood flow entering the glomerulus. So this maintains normal GFR. Whereas with NSAIDs, they block the prostaglandins, which results in the efferent arteriole constriction. So blood flow falls, reduced, which results in the reduced GFR, and in turn which damages the kidney. So what are the clinical signs of this? Low urine output, swelling and rising creatinine. So next category code is N15, renal tubulointerstitial disease, NEC. So what do you mean by NEC? Not elsewhere classifiable. So kidney inflammation that does not fit other specific categories. So this includes renal abscess N15.1, which is caused by severe bacterial infection inside the kidney tissue. So whenever renal tubulointerstitial diseases not elsewhere classified is diagnosed, you have to assign code N15. So N16 is for tubulointerstitial disorders in other diseases. So what are other diseases used when another diseases which causes the kidney inflammation such as diabetes, autoimmune disorders, sarcoidosis. So this is how you code N13, N14, N15 and N16 category codes. So next is N17 to N19 which includes acute and chronic kidney failure. So these codes they belong to ICD-10 system which is used to classify diseases. So this describe the conditions where the kidneys fail to filter blood properly. So what is N17? Acute kidney failure. So think of acute kidney failure as a sudden drop in the kidney function, like a power cut happening quickly. So what are the key features? Happen suddenly, hours to days. They often reversible if treated early, and they are caused by dehydration, infections, drugs, shock, obstruction, etc. So what are the important subcodes? N17.0 with tubular necrosis. So the kidney tubules, these are the tiny tubes that filter waste, they get damaged. So what are the common causes? Severe dehydration, sepsis and toxins. So next code N17.9, acute renal failure unspecified. So this is used when the exact cause is not mentioned. So what is the example? Acute kidney failure or acute kidney infection due to dehydration. So which code you will assign? N17.9. So next is N18, chronic kidney disease. So CKD, it is a slow long-term loss of kidney function. So it happens over months or years, unlike sudden AKI. So as kidney function droops, the body cannot remove toxins, cannot manage electrolytes or balance the blood pressure. So there are 6 stages of CKD. So each stage represents a progressive kidney damage. So the first stage is N18.1. So kidney is still working almost normally. Lab changes, they may show early kidney damage, often no symptoms. And N18.2, CKD stage 2, mild decrease in the kidney function. Early symptoms may appear like fatigue, mild and swelling. So N18.3, it is for CKD stage 3. It shows you the moderate loss of function. So waste products start to build up. Symptoms like swelling, anemia and high BP are seen within the CKD stage 3. So N18.4 is assigned for CKD stage 4, which results in severe loss of function. So what are the complications? Bone disease, metabolic acidosis and high potassium. So patient is close to kidney failure. So this is an example. Given CKD stage 4, you have to assign code N18.4. So next N18.5 for CKD stage 5, and you have a end stage renal disease for which you have to code N18.6. This is a final stage. So kidneys cannot support life without dialysis or kidney transplant in this stage. So this code is specifically used when ESRD is documented. So next N18.9 is for CKD unspecified. So this code is used whenever stage is not mentioned in the record. So here there is a visual explanation of the diagrams like stages 1 to 5, which shows you the kidney functions and kidney images. So stage 1, the kidney function or kidney looks normal, function preserved. Whereas 2, 3, gradual shrinkage, the paler color which results in mild or moderate loss. And stage 4 is for more structural damage, darker color which results in the severe loss. And stage 5, it is very shrunken kidney which results in total failure. So at the bottom of the picture, you can see the microscopic images of the kidneys. So the healthy glomerulus, these are the clear round filtering units, and the damaged glomerulus, they are scarring, thickened walls and fewer functioning cells. So scar tissue, it indicates the permanent damage which is commonly seen in the CKD. So this is a difference between the healthy versus diseased kidney diagram. So next is N18, unspecified kidney failure. So this code is used whenever documentation says kidney failure but does not specify it as acute or chronic. So next category codes is N22, N23, which includes urolithiasis. So urolithiasis means stones anywhere in the urinary tract. So stones can form in the kidney, ureter, bladder or urethra depending on where the minerals accumulate and crystallize. So this ICD-10-CM codes that helps to identify where the stone is located. So the first code is N20, calculus of kidney and ureter. So this category they focuses on the stones in the upper urinary tract, which includes kidney, ureter. Ureter is a tube that carries urine from kidney to bladder. So what are the subcodes? N20.0 for kidney stone, nothing but renal calculus. So there is a stone located inside the kidney. And N20.1 ureteric stone. So this is a stone located inside the ureter. And N20.1 2 kidney with ureter stone. So stone starts with the kidney and travels down into the ureter. So N20.9 is for unspecified stone. So this is used whenever the documentation simply says urinary stone, but the site is not mentioned. So next category code is N21, which describes about the calculus of lower urinary tract. So this includes the bladder and urethra, which is located below the ureterus. So N21.0 for bladder stone. So these are the stones which form inside the bladder. So this is common in people with prostate enlargement, chronic urinary retention and catheters. So what are the symptoms? Lower abdominal pain, difficulty urinating and blood in the urine. So next category code is N21.1, for which you have to assign the urethral stone. This is very rare. Urethral stone is very rare. So stone stuck in the urethra, what will be the symptoms? Severe pain, urinary retention and dribbling. So you have to assign code N21 for calculus of lower urinary tract, which includes both the bladder stone as well as the urethral stone. So next is N22, the kidney and ureteric stones in diseases elsewhere. So this category code, it is used when stones occur as a part of another disease such as hyperparathyroidism, kidney cystic diseases, metabolic disorders and severe recurrent UTIs. So this code, it indicates that the stone is secondary to the another condition. So you have to use N22 code whenever the stones are present in diseases elsewhere. So they are not present in the urinary tract parts. So next code is N23 for unspecified renal colic. So severe pain typical of stone blockage, but stone is not confirmed in these cases. So you have to use when report says renal colic but does not show the stone location. So in these cases you have to assign N23 code. So the right side you can see the picture which shows stones in different parts of the urinary tract. So the first is stagnant kidney stone in renal pelvis and calyces. So this is a large stone shaped like deer antlers. So this occupies entire kidney collecting system. So this is often due to infection and it requires surgery. So the second stone is kidney calyx. So these are small stones forming in the small chambers. So this is often silent until they move. Next is stone in the ureter. So it causes severe colicky pain. It leads to swelling of the kidney. And bladder stone is, it forms in bladder due to urine stagnation and often it is seen in older men with the prostate issues. And stone in lower end of the ureter. So pain radiates to groin or genital area. So very common site of obstruction. So this is about the urolithiasis. So this is for today's session. I hope this session has helped you. In the next session, you will be learning the continuation of ICD-10-CM coding classification for the diseases of urinary system. Thank you.